September is Suicide Prevention Month, and it's important to understand the signs and ways that you can help others who are struggling mentally. Joining us today to talk about Suicide Prevention Month is Dr. Jen Ray, the Program Manager for Suicide Prevention at the Ralph H. Johnson VA Healthcare System. Thank you very much for being here with us to talk about this.
Yeah, thank you.
This is a time of year where we become laser focused on what people are thinking and what they're going through. How can you help if you realize that someone may be having suicidal thoughts?
Well, the first thing is that we may not know. Someone might not come out and tell us, I'm having thoughts of suicide. And so knowing the warning signs is really important. If someone is feeling hopeless or helpless, if their mood or behavior is changing significantly, like becoming more depressed or anxious, or they're not sleeping well, or if they tell you they're looking for ways to die or harm themselves, or maybe even drinking or using more substances, these are times that we might stop and ask, are you thinking about suicide?
And if that answer is yes, what's the next step? Because that, whatever action that is, it can really change that relationship.
Yes, and it could also save a life.
That's
and
true.
So we want to make sure that people know what the resources are. People can call 988 anywhere in the U.S. And if you're a veteran or a family member of a veteran, you can press 1 to be connected to the Veteran Crisis Line. And it's a great resource. That responder 24/7 is going to talk you through what's going on and how to get that assistance.
Now, I've heard of the suicide hotline, the 988 number, and you think, well, that's good for people if they feel like they're going to harm themselves, they can call that and maybe someone will help talk them through it. But you're letting me know it's good for not just the person who's having those thoughts, but for the family member or the friend or the support who can get help for them.
That's right. And so the family member can call, talk about what's going on, get some advice, or have that crisis hotline responder call the person themselves. They can also help with the Veteran Crisis Line, connect that person to the VA or that family member to the VA if they need services.
Is this month more susceptible for thoughts of suicide?
No, it's more susceptible for people knowing how to ask that question and get people assistance.
Okay, and what's a good way to ask the question? Do you just come out and say, hey, are you thinking about harming yourself?
Yeah, that's a great question, and it's really hard because sometimes people don't want to ask because you don't know what to do with the information. So knowing what to do in advance is really important, and saying something that's clear, straightforward, and to the point. Are you having thoughts of suicide? Really can help save a life and get you the answer that you need.
And what is the VA doing to help decrease the amounts of veteran suicide?
Yeah, the VA has a lot of resources available within their own hospital and community clinics, so we can provide direct interventions for evidence-based care for psychiatric conditions. But beyond that, we also can do things that help decrease risk for suicide, like housing, employment, primary care, specialty medicine services. We know those are all risk factors. We also have people out in the community who are working to build coalitions and organizations who care about these efforts.
Well, that is great information, and thank you so much for sharing that with our viewers today. And if you or anyone out there is in need of help, you can always call 988 to talk with someone, or visit 988lifeline.org to get more information. You'll find a link to that and the Ralph H. Johnson VA Healthcare System on our website, live5news.com, under the big red box.